Hi, this is Dr. LOKESH. This is series of medical education make in India. Today's topic is competency-based medical education, which started in India 2019. So we're going to look into history, how it of the CBME, how it started in our presentation. So CBME, as you know, introduced in 2019 by NMC in India. It's actually into August 20th, 2019. It is contribution by many Indian academicians. It's a lot of work done, and it is in currently since last 5 years. It is in process, and is also introduced other countries such as South Africa, Ghana, and Kenya adapting. So where it started. So if you look at the countries where initially started, CBM is first implemented in developed countries like United States, adopted widely in the early 2000s. For residencies, there's post graduations, and then United Kingdom in 2017, postgrad medical education framework started competency-based medical education. If you look at Australia, our College of Physicians in 2016, and of course in Canada, then later Holland, Denmark, and Switzerland using the CBME. So I'm just going to spend a few minutes on the where the history in the World Health Organization. CBME is presented historically in 1978, the first report, most probably by the faculty of University of Illinois and international others had done this report. Is it started into 1978? Actually, if I look at some of the research previous articles, the thought process started also in 1949, long before the term competency-based education. There is Dr. Ralph Taylor made called Taylor rationale. See, currently in olden days, we read anatomy, physiology, and medicine separate. We're not what is the purpose? The education system, the combining together outcome-based based medical education is competency-based medical education. So here, this what is the purpose should a school seek to attain? What educational experiences can be provided to attain these purposes? How can these be organized? How can one determine whether these purposes are being attained? So this is the Ralph Taylor rationale. Then Case Western Reserve University, which is in Cleveland, Ohio, United States, early 1950s, the content of medical training would be more effectively delivered if focused on clinical relevance, not what the basic science we learn. It has to be clinical relevance next to systematic scientific foundation of individual disciplines. So they included Ralph Taylor as a consultant. The school integrated preclinical courses and clinical relevant objectives in 1950s to make the transition from theory to practice more natural. It was first step towards the outcome-based education. The name initially they stated outcome-based, then they changed it to competency-based medical education. The precursor of competency-based medical education is called outcome-based education. The outcome direction was adopted by numerous schools, particularly in the Western world, from the 1960s and in the present day. If you look at this report, World Health Organization report, international faculty and the mainly University of Illinois, led by William McGay and George Miller in 1978. And a white paper entitled Competency-Based Curriculum Development in Medical Education in the World, WHO white paper. It's not only, it needs in both developed and developing nations. So their authors are said it's very important to go all across the world, not just in the Western world. He's a lead author. Dr. McGay is a professor of medical education in Northwestern University, and he was also worked in University of Illinois during the presentation, and then North Carolina. Other author is Dr. George Miller. This picture I could not find in the web, so I have to ask NBME of United States, and they're courteous enough share from this news journal. Dr. Miller, he's in the middle. And I'll spend a minute or two on Dr. Miller's, which I researched. George Miller, 1955 to 59, he served as a coordinator project in medical education in University of Buffalo, created a multidisciplinary research team, served proof concept and study of medical education. And also Miller subsequently established Office of Research and Medical Education. So medical education, he made the office at University of Illinois. This is when he was there. This publication came in the WHO report, and he. Through his consultation relation with he has a lot of relationship with the World Health Organization. He's instrumental in promoting faculty training degree programs in the area of medical education in the United States and worldwide. So Miller also research development worked with led the development of association AAMC Research Medical Education Conference in 1962 and the formation of Society of Directors for Research and Medical Education 1965 and AAMC Group of Educational Affairs in 1971. In addition, he chaired Clinical Skills Steering Committee in 1996. And in 1985, Miller was the second recipient, National Medical Boards, who were the owners of, they produce USMLE and Hubbard Award for Excellence in Assessment in Medical Education. So a lot of work done by Miller, NBME, taken into their assessment. Currently, we take the USMLE exam. The research was done by these medical education pioneer authors. Miller also have a pyramid. Knowledge, that means you want to know. Competency, that means interpretation. Show how, performance, and does action. So it's something like um, Bloom's taxonomy. And also, I forgot to mention that Ralph Tyler, who was in initially he was at Bloom's is a PhD student for Ralph Taylor in 1949. He worked with the Cleveland Clinic at the origins of the competency-based medical education. You all know Bloom's taxonomy. And Dr. Miller named the first time in the world medical education department in University of Illinois. He changed the name Center for Educational Development to Department of Medical Education and established a new standard for medical school, including comprehensive assessment system in place of individual department judgment. Like instead of anatomy or physiology judgment or pathology, he said comprehensive assessment needed. That became influential in the model in the field of medical education and resulted in restructuring. Even our examination, USMLE exam, National Medical Board examination at the time, they restructured their exam on his work. And the other author is Dr. Thomas Van Don Telder, is also helped with WHO product. And there is a nice article which is give the whole origins and theoretical basis and empirical evidence on the competence-based education. Before they called outcome-based, and this nice article there, there's significant information. And Canada also started working in the project 1990s in the medical education. In 1999, American Council of Graduate Medical Education is like a postgraduate medical education in the USA, and American Board of Medical Specialties formed a committee, joint council in 1999. It took 2 years to make a framework on competency basis by 2001. In 2020, there's an international group of medical educators came, redefined the definition. It's a continuous process. And I like to mention a word about Association of AAMC, is established in 1976. These are American Association of Medical Colleges, all the medical colleges, MD medical colleges, AAMC, and they are the leaders in CBME for more than 2 decades. And they also work as an outcome-based approach to design, implement, evaluation of education program. The goal of CBME is to ensure that all learners, all the students, PhD faculty, achieve a desired patient-centered outcome during their training. Patient-centered outcome. So AAMC also shared in 2014 the 6 broad areas of the CBME were professionalism, patient care, procedural skills, medical knowledge, practice-based learning, and also system-based practice. What societies are involved in USA, before we go to society, the AAMC has a leader, and these are featured. They have in their website. They have competency undergraduation, emerging areas, competencies and priorities and guided resources, engagement, and the continuous work is going on. There are three societies, AAMC and also American Association of College of Osteopathic Association. Both are established in 1896 and 98. Then ACGME is established in 1981. They all co-sponsor the CBME framework and continuous work. And draft in 2024, also initial draft of undergraduate medical education competencies was developing, and they're circulating along in this year. And then they are feedback is sent to the community in the initial draft. Second draft is competency was circulated in April. So and was collected through May 10, and they will publish their reports. So I just want to take this opportunity. I just want to show some history which I learned. Hopefully, it will help us understand who are interested in the history of the CBME. Thank you so much.